COVID-19 has indeed had a serious impact on many aspects of our lives, including the cultural and religious sectors, which have taken a knock. Churches such as the Zion Christian Church have had to abandon their pilgrimage since Easter, and many other big churches have been impacted, having to comply with the restrictions, which includes limiting the number of congregants per service. Revered cultural practices such as initiation had to be cancelled. Good evening, I'm Aldrin Simpier, and this is Unfiltered. Tonight we ask you, how has COVID-19 impacted how you practice your cultural and religious beliefs? Remember that you can be part of the conversation by going onto our social media pages using the hashtag SABC Unfiltered. Let's welcome our guest this evening. We're joined by Reverend Mzwandile Molo, who is with the South African Council of Churches, and we also have Pastor Giet Khoza, who is a senior pastor at the World Changes Church of South Africa, as well as traditional healer Nomfundo Dlamini. And remember, as I've indicated, that you can also be part of this conversation using the hashtag SABC Unfiltered. Reverend Molo, let's start off with you. Good evening and welcome to Unfiltered. How would you describe this particular period since March up until now, December?
Good evening, Adrian, and good evening to the viewers. And thank you very much for having us as South African Council of Churches to have this conversation with you. If you were to allow us firstly to start by saying we want to give thanks to God for the wonderful work of those people who we call frontline workers, the doctors, the nurses, the police, who sacrifice their own time, their own lives, and put their own lives at risk to simply protect us and our people. We say to them, we as South Africans, at least at the SACC, are very proud to have you as fellow citizens. We also want to further give our own condolences to many, more than 21,000 or so of our people and the families who have lost their loved ones and who continue to suffer right now because of this COVID-19. We want to say to all of them, we wish them God's healing and God's love and embrace as they journey with the loss of their own family members who have been lost to COVID-19. The time that we as the SACC wish to describe, Adrian, this year is one that only people who have lived for more than 100 years or so would have gone through it. It is one that is unprecedented in many, many ways, because in living through this time, it came to us in a way that we were not prepared for it, precisely because we didn't anticipate 2020 to be defined by COVID-19. Most importantly, though, it attacked us in all aspects of our lives. It attacked us in our bodies, it attacked us in our social settings, it attacked us in our means of meaning, it attacked us in our own sense of what it is to be community. It disrupted and created a way of life that we have never seen before, except for those who might have lived 100 years or so ago. And as SACC, therefore, we describe this period as one of disruption, indeed, possibilities of finding new ways of being people of God and being citizens of the world. It is a time for disruption, but at the same time, a time for renewal.
And we'll come back a bit later on and look into those disruptions. Pastor Khoza, how would you describe this period?
Wow, what a year. First, also, I would like to echo what Reverend Molo have said in terms of sending our condolences to those, our frontliners, the police, the soldiers, the nurses, the doctors, particularly those who have lost their life in the fight against this unseen enemy called COVID-19. But we raise our hands and say to those who are out there, we want to thank you, you and your families. And those who have lost their loved ones, the same as Reverend Molo have said. Yeah, you know, Adrian, our resolve has been tested to the limit. Our faith was tested to the limit. Our patience has been tested to the limit. Our love for ourselves and love for others was tested to the limit. Our courage has been tested to the limit. So everything we know has been tested, we've been stretched. So in a nutshell, this has been a tough, challenging, and difficult year. But the good thing is that God is keep carrying us through.
Yeah. Okay, and let's hear from Nomfundo. Nomfundo, how would you describe this period since March and all the restrictions that have been put in place? But of course, we'll go through some of those details, but just a sense of how you were able to practice your spirituality, or whether or not even your own spirituality felt a sense of disruption.
Hi, Elgin. I think for me as a traditional healer, it's been an eye-opening experience, you know. Interestingly enough, because I practice in the digital space, it did not really hinder a lot of my work. But I think the interesting aspect for me was more the learning just around African spirituality itself and how it's not limited simply because we now have these restrictions. You know, we've still been able to help people, and we've just had to sort of find ways to navigate around how do I now send people treatment, for example, if I need to do that with all the regulations in place. But I think the other important thing that we all learned is to be more conscious just around safety and safety precautions. And I think in that sense, it's really helped coordinate a lot of our work more. And fine, it's been quite confusing, but I think for the future, it's some change that's going to be really good for us.
Mm-hmm. So at least you have benefited with the whole fourth industrial revolution and how social media has also taken to push people really into new sense of e-commerce.
Definitely. And I think obviously because the traditional healing space is not seen in that way, it's been very interesting how even the differences in how we work as traditional healers have impacted some of our work. So I know a lot of healers that I know who aren't in the digital space yet are either starting to go into that direction or start questioning that direction because of the limitations that came with COVID-19.
Okay, so we're going to go to a quick ad break. When we come back, we're going to be looking into those challenges and zoom into those challenges that the various religious groups as well as the spiritual groups have faced during the period of COVID-19. And as we've indicated as well, that you can be part of the conversation using the hashtag SABC Unfiltered. Tell us about how COVID-19 has impacted how you practice your religious or your cultural beliefs. And welcome back to Unfiltered with me, Aldrin Simpier. It is December. We have been under lockdown since the announcement from the president back in March, and we are currently under level 1. However, though, there's also this upsurge that the president has warned us of, and we also heard earlier on this month from the Minister of Health saying that the country has now officially entered the second wave of the COVID-19 resurgence. However, though, we need to reflect on the past few months under lockdown and how those past few months have affected the religious sector as well as the cultural sector. This evening, my guests are Reverend Mzwandile Molo, who is with the South African Council of Churches. We also have Pastor Hit Koza, who is a senior pastor at the World Changes Church of South Africa, as well as traditional healer Nomfundo Dlamini. Pastor Molo, let's start off with, Pastor Koza, let's start off with you. So Nomfundo speaks about consulting using the digital space. And churches have been forced into that space as well to start having services online. How was that for you? Because ordinarily you'd have a congregation in front of you. And sometimes I'd argue and say that you almost feed off the energy of the congregation. But this time around, they're online.
Well, your argument is right that you feed off the congregation. I think the difficulty, what we faced was that, fellowship is about meeting, congregating together, encouraging one another, and fellowshipping and thanking God together. And that was a difficulty, Adrian, not to be together and trying to find a way of pastoring the church, find a way of encouraging, because for us, not to sit with a person and say, look, let's pray together. You're going through this will, God will come through. And now it had to be done over the phone, now it had to be done over emails, and more so on a Sunday we have to go on Facebook. So it was a learning curve. You have to change, the way we do things. And in a more difficult, the congregation are not used to sit on Facebook and just watch you there. But over the period of 6-7 months, you get used to that. So in a way, we said this has pushed us to that space where you have to be digital, you have to upgrade. But the only thing is that now your things must work. Everything must work, which sometimes is a challenge. People don't have data, or where they are, their phones are not working. They don't have the smartphones. So it's a very, very difficult time. But, so far, I would say we're doing our best we can to pastor, because the big thing is to pastor the congregation, but not only the congregation, even the people around the community to be there. When people say this is, we don't have food, we don't have this, you've got to be there. So it's very, very difficult. But, we're doing our best, we're giving it our best, and it's working, but you wouldn't say it's 100% like you will be in the setting of a building.
Yeah. Would you then say, Pastor Kosa, that it has had an impact in the efficacy or the effectiveness of that fellowship? How you're used to it, and you could see the response and how the congregation or the congregant is responding to that. And this time around, things are a bit different because it is virtual.
Yeah, the impact has been, truly speaking, very negative. Because, when you start being on Facebook, remember, some people are elderly. You have to teach them how to log in. And some areas you have to use your WhatsApp video messaging to send the message. So it's very, very difficult. And the people that we pastor, from at least from my side, it's mixed. You have elderly, you have young people who know. So the young people help to help the elderly. And where it was difficult was that you couldn't even visit the elderly. That was very, very difficult. It was very sad. But now with where you can go, to go and show them how to do, how to download Facebook, how to download WhatsApp. So all these things that, when the elderly and the people that were not in this space, you see how they impact. Yeah. So the impact of not coming together has been absolutely negative. And nothing, even I still say now, nothing will take away the coming together, yeah. Congregating together. That is the core of a church, fellowshipping together. But of course, we have to learn a new way. We have to learn this, we call it this new normal. But it's very difficult, very, very difficult, Adrian.
And Reverend Molo, the point that Pastor Kosa now raises around this sense of togetherness that we've always had, but also what it brings with it is a sense of belonging. That I belong to a certain group. I am with a certain group. And it also informs your sense of identity. With the conversations that you've had with your congregants, did you find at all that some became a bit despondent?
The truth, Adrian, is that the coronavirus, COVID-19, in its manifestation in our midst, challenged us in ways that makes us think again about what it is to be community. What does it mean to be together? What does it mean to worship? What does it mean to pray to God? Indeed, before COVID-19, there is a way that we did it without any real deep reflection, because people could congregate, and therefore in our congregation as people, we were able to just take for granted our ability to be together. COVID-19 then says, in its attack on that fabric that brings us together, we must now ask the question, what does it mean to worship God together without physical proximity? And that has been the biggest challenge we face. And you can complicate that, Adrian, by not only asking what does it mean to worship together, but what does it mean to be a community together when people have lost loved ones. In our traditions, inclusive of just being church, but in our traditions, we have this idea that when somebody has passed on, or you feel pain, or you feel difficulty, we congregate around you so that when we leave you with less pain than you felt before we came in. So all those things have been taken away. We now have to learn to say to ourselves, we must depend on other ways of communicating our love for one another. That does not depend on physical proximity.
Reverend
for us,
Molo,
in many ways.
Reverend Molo, would you then say that what it has done also is that it has prolonged the healing process or even the effectiveness of being able to comfort a family that is in grieving?
Indeed, it has depended. It has depended. The pain of death, for example, is deep in its own. The coming together of the community seeks to lift you up so that you don't feel the loneliness. Adrian, in your family, you would have had many people who come in and say, "Awedwa, you are not alone. We are with you." And now, at least when you see people hear their voice and see their eyes, you feel that.
Yeah.
We now needed for you to depend on our voices rather than our faces.
Okay.
And we needed to find those ways, Adrian, that makes people say to themselves, this feels unnatural, this feels lonely.
Yeah.
But we needed to find a way to reach out to people. And I'm not saying that way is it is not effective.
Yeah.
It is not as effective as we knew the other.
As
and we are
used
now
to.
learning to find ways.
Okay, let me just quickly bring in.
Another.
Yeah, let me just quickly bring in Nomfundo into the conversation. Nomfundo, you of course being in the digital space, but one must then admit as well that the people that you are consulting, who may be on the other side of the phone or the other side of the computer, come to that space with a sense of anxiety.
Yes, indeed. I think apart from the anxiety, so I also had a lot of clients who actually did have COVID-19 and were finding themselves in places where they were really uncertain about the future, you know. Lucky for me, some of those clients are people who I could give messages to just around saying to them, actually, this is a passing phase for you. You're going to be okay, and let's look forward and into the future. So I think for me, with regards to consultations, it was quite a journey because people were calling on more because they wanted a sense of knowing that there really is a future and that at the end of the day, there still is hope. And because the sessions are quite one-on-one, it is an interesting sort of conversation to have with someone because you're saying this to someone yet you yourself are not certain of the future because of COVID-19.
Okay, and that uncertainty, of course, plays a role in how we see the world and also understand the world as well. So the conversation continues just after the break, and as I've indicated, remember that you can be part of the conversation by tweeting hashtag SABC Unfiltered. Tell us about your experiences around practicing your cultural beliefs as well as your religious beliefs. And welcome back, Nomfundo. So just starting off from the conversation that we had earlier on, for you personally, do you feel that you had a sense of your own faith was being tested and your own knowledge and understanding of the world, even through the spiritual realm, became a contested space?
Yeah, I think definitely for all of us. One of the things that I experienced was complete silence before COVID-19. And I thought, geez, as someone who dreams a lot of things, this is awkward, you know. I did have actually one of the people I was training who did give me an indication that something was coming. But I think the magnitude of what came was not what I imagined from the small signs that she had given me. And I think when COVID-19 did come, immediately all of us were afraid and asking our ancestors on a daily basis to say, "Vokokona bomkhulu, kwenzakalani? Yini le engaka esiyenzile? Niyashaya, nisenzani? Sifuna ukwazi so that if khona lokhu esikwenzile kini, sikhone nathi ukuthi lokho sikulungise," you know. So I think in the beginning of COVID-19, I really had to find my feet and really deeply connect with my ancestors in order to find a rhythm and also a way in which I would be able to communicate to whoever was coming to me, because at the time I was anxious as well, you know. But I think one of the things that really got me into it was realizing that there's nothing any of us can do. And because of that, we just need to continue with the rhythm of what we know to be working for us at that time and use that as a tool that would potentially move us forward. And I think for me, it actually deepened my faith, you know, because suddenly things did at least get a little bit better. And now that we are having a second wave, I do think we are better prepared, better equipped. And if we all follow the regulations, I do think we might lose less people, you know.
Mm-hmm. Did you find the answers that you were looking for? Nabomkhulu, did you find those answers, or did you find something at least that you could hold on to try and make sense of this period?
Yes, indeed. So I think for me, it was really to stay firm in my faith when it comes to abogogo nabomkhulu bethu. Nokuthi ayikho into eyenzakalayo emhlabeni okuwukuthi ayiplanwanga, you know. Ngesinye isikhathi mawumuntu siyathanda ukuthi sihlale siphangisile, sijahile, sizame ukuthi izinto sizibheke ngendlela yethu. But I think for us, the message was really introspection. It was really to slow down. And in a lot of the sense of Africanness, it was to go back to the original things that you had done as an African person. If it was connecting, if it was ways in which you needed to go back and communicate with your ancestors, it was to go back a lot into the history of even your family and to find the roots and to hold on to that, if anything. And I mean, interestingly enough, because I work with herbs, one of the things was, what herbs could I find in my garden or in my grandmother's garden that would maybe not heal me from COVID, but protect my immune system against something like a COVID-19? And I think that for me was a saving grace because I haven't been sick this whole period, you know. My clients haven't been sick, apart from the few who already did have COVID-19. And I thought, for me, geez, how beautiful is that there are plants in our own gardens that our ancestors had used prior to even this time, that we are now able to go back to, like Admija, like even in Tango, and say, how, or in Pepo, I can actually drink this, and this will allow me to at least get a better sort of wave of this, you know, and I found that really interesting, but really beautiful at the same time.
Okay, so what we want to touch on now, Nomfundo, thank you so much for raising that particular aspect, and that is around our own indigenous knowledge systems and whether government at all was keen at all to tap into those indigenous knowledge systems, and some people would argue that that wasn't the case. But also the involvement of the religious bodies around how government is responding to COVID-19, and also considering that there are, of course, the elderly and those who are sick who would need some sort of divine intervention, which they believe that their spiritual leaders would be able to bring. That conversation just after this. We just have to say goodbye to our SABC 3 viewers. The conversation continues on the SABC News channel on 404. Okay, and welcome back to Unfiltered with me, Alderin Simpier. Before we get to that question around the cooperation between government as well as the various stakeholders, let me just quickly find out from Reverend Molo. You touched a bit on this earlier on around the testing of the faith. And I wonder then from the congregation side that the Reverend might have a sense of conviction around his faith. However, though the congregants not so much. I even found myself questioning even the existence of God at some point.
That the assumption, Adrian, that I, as a man of leading a congregation, is automatically settled in my faith about God in moments like COVID, is a quite a dangerous one, because indeed none of us have ever faced COVID-19 situation. So there are many of us, including myself, who struggle to make sense of how we must continue to believe in God in a context where everything that we seem to know about God and life is under attack and seems to be crumbling just in front of our faces. And the most vulnerable, which is one of the most difficult things about COVID-19, is that in its spread, it spreads out of a certain class of people. Its devastating effect is on a certain class of people who are not responsible for the spread in the entry moment. But precisely because they are poor, they are vulnerable, they themselves now become victims of something that is not spread primarily by them in their moment of engagement. So we have to ask questions about God. So indeed, you asking God's existence is not a strange thing for those who take Christian faith seriously, because throughout the Christian scriptures, there are always moments where Moses himself will come before God and say, if you don't show yourself, I'm not going to move forward because you are too quiet. The Psalms are replete with questions of God's silence in the moment of crisis. So we enter that space of crisis with the questions whilst not losing the faith totally, obviously, as the person who is at the center of leading the congregation, part of my responsibility is to allow the questions to emerge and allow God to answer with honesty without trying to defend God in a moment where the people are asking, where God, where are you? Because it's Jesus himself who in the moment of great pain cried out, Eloi, Eloi, lama sabachthani, why have you forsaken me? So the question of grappling is a typical Christian experience. And my job as a pastor and those who are pastors allow their congregations to ask the questions without them making feel bad about them. And what we sought to do as the SACC, it is to create space for churches to develop protocols and ways of communicating so that our people do not hear the coming of COVID as some kind of punishment from God, and therefore create this sense that God has forsaken them. We were clear in our mind that the message to our people, this is a man-made situation. There's no divine origin for COVID-19. It is the irresponsible act of human beings in a given space and time. And what we need to do, therefore, is not to interpret it as if God has forsaken us, God is angry with us, God believes you are bad people, God has released fire and brimstone on us. No, it is a reality of human actions, and we must therefore interact with it, with that belief that God has not forsaken us. And when we think God is silent, we cry out, like the lamentation in Jeremiah. We cry out, but we must tell our people that our faith is not dependent on the absence of crisis. It is depending on deepening our understanding of God in that moment of crisis. And if I may say something, Adrian, the beauty of COVID-19, it is to make us realize that the starting point of worshiping God and building our faith is not the church building, but it is our families. It is our friends. It is those people. That's the best place. When we meet on Sunday, we meet to conclude. We don't meet to start. We meet to raise. We don't meet to start. So Sunday, the building is not the place where God is in a limited sense. Sunday becomes us coming together because God has been with us in our homes, our offices, and indeed in our streets and our communities. And if we find God there, Adrian, Sunday becomes a cherry on top. It does not become the definer.
Okay, and Pastor Kosa, what's your understanding of that? And even that sense of, earlier on we were speaking about congregation and coming together, and how we are used to that, at least those who do attend church, you become used to that, and that sense of belonging. And again, at the same time, you have your own faith being tested.
Like I said in my opening, I think the challenging, Adrian, where you have to do a funeral on Zoom. The elder asking, why can you come here? Are you also scared? And so those are the questions that we had to grapple with. Firstly, as a man of God who leading the congregation, and secondly, trying to bring the congregation forward. So one of the things that we really try to focus on is that people should not lose hope. Because when you lose hope, a lot of things tend to go the other way. So it's to try and encourage people to stay hopeful that tomorrow will be better, even though you don't know how tomorrow will turn out. But if you can celebrate today, you can hold on today and believing that tomorrow would be better. So what we did, we seek to do, we had some prayer meetings that we had, because we felt that the prayer meetings, even though it was on Zoom, even though other people would join on WhatsApp, we felt that it brings us together, we hold us together, we encourage us together, we cry with each other. It's as sad as it was to cry on Zoom, but we did cry on Zoom. People did cry on WhatsApp, and we felt that as we daily meet, so that to keep the hope. So we focused the hope. And then the second thing we did was to make sure we love each other. We are there. We might not be in your home, but we are there on WhatsApp, on Zoom, If you needed food, we make sure you have food. If something has happened in the hospital, we try and contact, we make sure we're there. So keeping those two things, the love and the hope, really has helped us. Even though we're grumbling, people are asking, Pastor, where is God now? And it's a difficult question to answer. There is no answer. You just
What
keep
do you
saying.
say? What do you say to them?
Sorry, Adrian?
What do you say to them when they ask you that question? Where is God?
Well, we say God is with us. He's putting up the fact that we're here today. So the main thing you have to talk about today, because you can't talk about tomorrow. Even the Bible said tomorrow is not promised. We'll talk about today that God is putting, because I think, truly I believe this, it's through the crisis that your faith is strengthened. It's through the crisis, it's not through the great times. It's through the crisis where your faith is being strengthened and you go deeper. You find very quickly what you believe on when you are in the midst of the crisis. So we focus on strengthening the faith that God will pull us through. And we believe, again, I'll say this publicly, we also believe that the prayers we did help to contain some of the spread. We use some of the campaigns with the SACC, but we do believe the prayers of believers have really protected a lot of people. We believe that strongly so.
Okay, then Reverend Molo, let's move over to this conversation, and that is the cooperation between the religious bodies as well as government. So you have the NCCC that is established, and of course the NCCC would then give the recommendations which are ratified by Cabinet around how the country is responding to COVID-19 and trying to curb the spread of the virus. Do you think that the religious bodies have been adequately consulted at least?
Thank you, Adrian. Adequately it's a word that it depends on the person who will say that's adequate or not. What I'm prepared to say, we have had many interactions with the government in the highest levels of government and in the ministry, for example, and those who work in the MAC in terms of communication and everything. So there has been conversations that have taken place even as we moved towards the first lockdown. There was conversation, at least from the South African Council of Churches, with the state president and those in government to say, we see this thing coming. What are your plans? We are afraid this will affect our people. And that would have meant to and fro. And during COVID itself, we have sent delegation to meet with the government, and the government have asked for meetings with us. And part of that has been the conversation of what do churches and religious institutions wish to initiate to have as a way to move forward. The South African Council of Churches, for example, on its own volition, anticipating the reality that COVID-19 will remain with us, not for 2 months, not for 3 months, not for 6 months, designed what it's called itself norms and standards of what we believe churches need to be, so that when we live with COVID-19 and have to ask government to say we want to operate as church, what will be the acceptable thing that we can do with government? Mm-hmm. We have made representations to government asking for certain things around needing to protect the vulnerable, needing to make sure that those who have lost their jobs, people do not go hungry. We have made those conversations with government. We have spoken to government about issues of education, but we do know that we make we make representation to government, and government must take a fuller picture that we do not have, because we do not have scientists who are sitting with us to give us everything that we need to make a broader decision. Okay. So there has been serious conversation taking place. Whether it is adequate, we might all have to look back and sit down, Adrian. And perhaps, again, I don't want to take your time. The issue of communicating with our people the messages of how to maintain COVID-19, especially as we move to this period now of the festive season and the period of moving beyond this second wave, is one that we still must all answer and make sure that we do not lose lives unnecessarily at a point where we as individuals must take responsibility beyond what government asks us to do.
A very important point that you raised there, Reverend, and when we come back, we'll touch a bit on that, looking reflectively on how some churches have outrightly refused to adhere to the COVID-19 regulations. And yet here we are, we have made it, and unfortunately there are some that we have lost along the way. But we are where we are at the moment, and we're slowly approaching the 1 million mark of COVID-19 infections. What is it that churches and congregations can do differently around this time around? Because the president is also warning about those super spreader events. And also the question around the indigenous knowledge systems, that conversation just after this. And welcome back to Unfiltered. We've come to the end of today's show, but just before we wrap up today's conversation, let me just get some closing remarks from our panelists. And as we've indicated that today we're joined by Pastor Hit Koza, who is a senior pastor at the World Changes Churches of South Africa, as well as traditional healer Nomfundo Dlamini and Reverend Mzwandile Molo, who is with the South African Council of Churches. Pastor Koza, looking back at the announcement that was made and also how government had to urge churches and plead with churches to please rethink the idea of the usual Easter pilgrimage and how difficult it was. I just need you to quickly touch on that and then also speak to us about what you think churches should be doing now, since we have now entered the second wave of insurgence or resurgence.
Yeah, I think because we were part of those discussions of this with government, we all agree that the best way at the beginning of this pandemic was to try and limit the gathering of people. And that we believe that was the right decision, and it helped to save a lot of lives and also not to spread the virus into other people. So as we come now, whereas maybe some kids have said that it is now a second wave, we really want to plead with the churches. First of all, is to follow the protocol, the hygienes that are there, washing your hands, social distancing, the masks, and avoid really gathering in big numbers, because we mustn't say God will protect us. We need to be wise. God has given us wisdom, so we need to use our wisdom and work with our government. And we just want to plead with our people, particularly the funeral after tears. Please, people, can we stop this and do things properly? Stick with the 50 or the 100 and do the social distancing. And if you gather, stick with the 250. And these numbers are going up, We just really have to be vigilant. Let's protect one another. Let's protect the elderly and the people that are traveling to different provinces. I would say, if you can help it, why don't you stay? Send the money if you can. Avoid traveling. And in terms of our churches, let's spread the word. The churches, we must set an example. We must be the one who's leading the way. We must be the one who's leading the society. This is how we do. And on top of that, let's continue to pray. God will help us while we're doing all other things and show how it's responsibility. And also want to call the young people out there. The young people, please stop this party. The parties will come another time. This is not a year for parties. We call on you, young people, please. Yep. Thank you.
Okay, Nomfundo, just quickly listening into Pastor Koza as well as Reverend Molo, it almost sounds that the state had quite a cordial relationship with the religious bodies. But I wonder, when it comes to traditional healers at all, what has that relationship been like? How would you characterize that?
I think in the beginning, a lot of traditional healers felt sidelined, and I think they felt that for some reason government had amnesia about us having access even to the African herbs. But more than that, us actually being health practitioners within South Africa, and health practitioners who actually are visited more than people visit their clinics or their hospitals, In May, there was a guideline document which was drafted and sent to traditional practitioners just around how we should be running things, But I think what lacked in that particular document was the stipulation around when we do use African traditional methods or herbs, how is it that then later maybe we could use these as references even to assist government itself in ways to curb COVID-19, not only for now, but even for the future with something like a second wave coming on. So for me, I think as a healer, I was quite dismayed at that point in time, but I also came to the realization that, you know, as Africa, we are all growing, we are learning, you know. So one of the things that African traditional healers need to do as well is to go into spaces and fight for their space within South Africa and within government, because if they don't, then we'll always be ignored. Will always be seen as people who probably aren't intelligent enough to solve societal problems, which for me is to the contrary, because I believe that a lot of traditional healers are quite smart. We have quite a lot of knowledge that's been passed down from generation to generation. And I mean, I myself am a specialist in my own field apart from the space of traditional healing. So we cannot be that stupid that we're not be able to help in this particular disease, you know. But I think this is a long-standing conversation that luckily maybe because I'm as young as I am, a lot of other traditional healers who are my age or who we call the new age traditional healers will commission and will push over the years to come, so that one day when another disease like this comes to our country, government then sees that traditional healers are not just there to take up space. We are there to make change, and we are there to help people. And even in terms of listening and taking guidance, we are not one-sided in our thinking. So in the future, we should be thought of, we should always be included, and as Africans, we should be respected.
Okay, Nomfundo, just quickly in a couple of seconds, there was a commitment earlier on this year from the Minister of Health that they would be looking into some of the traditional herbs and see whether they are able to boost the immune systems of people who have COVID-19. Have you received any feedback as yet? I understand that this was done at a university.
No further communication that I've received in particular. The last document I received and went to was the guideline document. But in any case, traditional healers are probably assisting people in their field of work because we don't have a choice. People are coming to us.
Okay, thank you so much for that. We've come to the end of this evening's show. Thank you so much for tuning in to Unfiltered with me, Aldrin St-Pierre. From me and the rest of the team, it is goodbye. Enjoy the rest of your evening. And remember to keep safe, always wear your mask and make sure that you also wash your hands. Goodbye.